Welcome to the Dr. Izzy's Medical Podcast channel.
Question: where is the obstruction located in open-angle glaucoma? Answer: distal to the anterior chamber angle. Question: what is the treatment of uric acid nephrolithiasis? Answer: hydration and alkalinization of the urine, with potassium bicarbonate. Question: what gene is involved with simple endometrial hyperplasia? Answer: PTEN. Question: what is the most common type of breast cancer in males? Answer: invasive ductal carcinoma. Question: what type of vasculitis is Henoch-Schönlein purpura? Answer: small vessel vasculitis. Question: what is the morphological hallmark of reversible cell injury? Answer: cellular swelling. Question: which type of collagen is made in excess in a hypertrophic scar? Answer: type 1. Question: which agent secreted by small cell carcinoma of the lung can cause Lambert-Eaton syndrome as a paraneoplastic syndrome? Answer: autoantibodies against CA channels at the neuromuscular junction. Question: which type of multiple endocrine neoplasia is known as Wermer syndrome? Answer: MEN1. Question: what does the M in TNM tumor staging signify? Answer: distant metastasis. Question: how does PT change in von Willebrand disease? Answer: no change. Question: which type of crystals are involved in pseudogout? Answer: calcium pyrophosphate. Question: how does lung recoil change in emphysema? Answer: decrease. Question: what is the karyotype in female pseudohermaphroditism? Answer: XX. Question: what are the two complement components that function as anaphylatoxins? Answer: C5a and CEA. Question: what cancer is associated with schistosoma hematobium? Answer: squamous cell carcinoma of the bladder. Question: what is podagra? Answer: acute gout of the big toe. Question: what demographic of women are commonly affected by ovarian cystadenocarcinoma? Answer: postmenopausal, 60 to 70 years old. Question: what is the most common pathological cause of galactorrhea? Answer: prolactinoma. Question: which type of leukemia is the most responsive to therapy? Answer: acute lymphocytic leukemia. Question: what type of stain is used to visualize amyloid? Answer: Congo red. Question: which cancer is associated with radon? Answer: lung cancer. Question: what is the mechanism of action of conivaptan in the treatment of syndrome of inappropriate secretion of antidiuretic hormone? Answer: nonspecific antagonism at vasopressin V1 and V2 receptors. Question: what level of visual impairment is considered to be legally blind? Answer: 20 to 200 to 20 to 400. Question: what is the treatment for beriberi? Answer: thiamine, vitamin B1. Question: which adrenal glands are atrophied in Cushing syndrome caused by an ACTH secreting pituitary adenoma? Answer: none, there is bilateral adrenal hyperplasia. Question: what is the most common benign neoplasm of the breast? Answer: fibroadenoma. Question: what type of diabetes is associated with acanthosis nigricans? Answer: non-insulin dependent diabetes, insulin resistance. Question: what type of lung disease is associated with sarcoidosis? Answer: restrictive lung disease, interstitial fibrosis. Question: which type of systemic amyloidosis is associated with plasma cell dyscrasias? Answer: primary amyloidosis, with AL amyloid. Question: polymorphisms in which cell surface protein on regulatory T cells are associated with autoimmunity, for example MS and type 1 diabetes mellitus? Answer: CD25. Question: which oncogenic virus is associated with Kaposi sarcoma? Answer: human herpes virus 8 disease. Question: which type of renal cysts are septated, enhanced or have solid components, especially on CT? Answer: complex. Question: which immunohistochemical marker is expressed in carcinoid tumors? Answer: chromogranin A. Question: how do GLC levels change in hyperthyroidism? Answer: hyperglycemia. Question: where in the appendix is appendiceal carcinoid typically found? Answer: in the tip. Question: what type of hypersensitivity is involved in contact dermatitis? Answer: type 4. Question: which two genes are combined in chronic myelogenous leukemia as a result of the Philadelphia chromosome? Answer: BCR-ABL, causing increased tyrosine kinase activity. Question: what is the most common mechanism that causes gout? Answer: underexcretion of uric acid, seen in 90% of patients. Question: which neoplasm is associated with acanthosis nigricans? Answer, visceral malignancy, especially gastric. Question, on which chromosome is presenilin-1 found? Answer, 14. Question, what does Barrett's esophagus have the chance to become? Answer, adenocarcinoma of the esophagus. Question, what is the most common malignancy of the salivary glands? Answer, mucoepidermoid carcinoma. Question, what is the core syndrome of bipolar I disorder? Answer, manic episodes. Question, what group of renal disorders includes focal segmental glomerulosclerosis? Answer, nephrotic syndrome. Question, how many allele deletions must be present in order for there to be clinically significant alpha thalassemia, with anemia? Answer, 3+. Question, which autoantibody is seen in drug-induced systemic lupus erythematosus? Answer, antihistone antibodies. Question, which COPD is associated with a barrel-shaped chest? Answer, emphysema. Question, which receptor on target cells is involved in the extrinsic receptor ligand apoptosis pathway? Answer, FAS death receptor, CD95, or TNF receptor. Question, which autoantibodies are associated with diffuse scleroderma? Answer, anti-SCL70, anti-DNA topoisomerase 1. Question, which tumor is associated with the tumor suppressor gene BRCA2? Answer, breast and ovarian cancer. Question, what globin chains are found in adult HB2? Answer, alpha-2 delta-2. Question, what gene is involved in inherited familial adenomatous polyposis, colon cancer? Answer, APC, adenomatous polyposis coli tumor suppressor. Question, what is Zollinger-Ellison syndrome? Answer, persistent and resistant ulcers due to a gastronoma. Question, what is the etiology of primary focal segmental glomerulosclerosis? Answer, idiopathic, not well understood. Question, what demographic of women have an increased propensity to develop triple-negative carcinoma? Answer, African American women. Question, which autoantibody is commonly involved in rheumatoid arthritis?
Answer, rheumatoid factor, anti-IgG, IgM antibody, targets the Fc portion of IgG.
Question, which arteries are commonly affected with Munkeberg medial calcific sclerosis? Answer, radial and ulnar arteries. Question, to which protein in the extracellular matrix do cancer cells bind to spread locally? Answer, fibronectin. Question, which type of chronic gastritis involves autoimmune destruction of the parietal cells? Answer, type A. Question, what is a mosaic pattern of lamellar bone, aka cement lines, commonly indicative of? Answer, Paget's disease of bone. Question, what is the most common cause of pharyngitis? Answer, group A streptococcal infection, Streptococcus pyogenes. Question, on which chromosome is the amyloid precursor protein, APP, found? Answer, 21. Question, which lymph nodes are commonly involved in the spread of renal cell carcinoma? Answer, retroperitoneal lymph nodes. Question, which type of vulvar carcinoma is typically seen in women of reproductive age? Answer, HPV related. Question, how long after a myocardial infarction will interventricular septal rupture occur? Answer, 3 to 14 days. Question, which enzyme upregulated by cancer cells functions to degrade the basement membrane, thereby allowing for tumor invasion and spread? Answer, collagenase, metalloproteinases. Question, what is the primary source of most cancer metastasis to the lungs? Answer, breast, colon, prostate, bladder. Question, what translocation involving PML and retinoic acid receptor causes acute promyelocytic leukemia? Answer, T15, 17. Question, how does TLC change in COPD? Answer, increase. Question, what gene is involved in 5-alpha reductase deficiency? Answer, SRD5A2. Question, what is the cause of verruca? Answer, HPV infection of keratinocytes. Question, how long after a myocardial infarction will Dressler syndrome manifest? Answer, 2 weeks to several months. Question, which TLR on macrophages recognizes LPs on the outer membrane of gram-negative bacteria? Answer, TLR4, alongside CD14. Question, what genes are involved with hereditary non-polyposis colon cancer? Answer, MLH1, MSH2, and MSH6. Question, which gene is involved with complex endometrial hyperplasia? Answer, HMLH1. Question, What is the most common invasive breast cancer? Answer: invasive ductal carcinoma.
Thank you for listening Dr. Izzy's medical podcast series. If you want to support this project, please subscribe the channel and like this video. Thank you.